Imagine you're walking home after a long day. Everything feels normal. Then suddenly, you feel a sharp pain in your lower back. Within seconds, the pain travels through your buttock, down the back of your thigh, and sometimes all the way to your foot. Many people think this is just back pain, but in reality, it could be something called walking, sitting, or even sleeping extremely painful. But why does this pain travel all the way down the leg? What exactly causes it, and when should you be concerned? In this video, I'll answer all of these questions in a simple and easy-to-understand way. Let's begin. Welcome to MediLearn Hub. Here, we make medicine and physiotherapy simple for everyone. Whether you're a healthcare student or simply interested in understanding your body better, you're in the right place. What is sciatica? The first thing you need to know is that sciatica is not actually a disease. It is a symptom. Sciatica happens when the sciatic nerve becomes irritated, inflamed, or compressed. This irritation produces pain that usually begins in the lower back or buttock and travels down one leg. The pain can be mild and annoying, or it can be severe enough to make walking difficult. Some people describe it as a burning sensation. Others describe it as an electric shock. Some feel numbness or tingling instead of pain. Because the sciatic nerve is so large, irritation can affect different parts of the leg depending on where the nerve is compressed. Understanding the sciatic nerve helps explain why these symptoms occur. The sciatic nerve is the largest and longest nerve in the human body. It begins in the lower part of the spine. Specifically, it is formed by the nerve roots from L4, L5, S1, S2, and S3. These nerve roots join together inside the pelvis to form one large nerve. The sciatic nerve then passes through the buttock, travels down the back of the thigh, and eventually divides into smaller branches that supply the lower leg and foot. This nerve controls many of the muscles responsible for movement in the leg. It also carries sensory information from the skin back to the brain. Because this single nerve supplies such a large area, even a small amount of pressure on one of its nerve roots can produce pain that radiates throughout the entire leg. This is why someone with a problem in the lower back often feels pain in the leg rather than just the back. That phenomenon is called radiating pain. It happens because the brain interprets irritation of the nerve as pain along the entire pathway supplied by that nerve. This is one of the most common questions patients ask. The answer lies in the nervous system. Think of the sciatic nerve like a long electrical cable connecting your lower back to your foot. If the cable is squeezed near its origin, the signals traveling through that cable become disturbed. Instead of only feeling discomfort where the compression occurs, the brain interprets pain along the entire course of the nerve. That is why a problem in the lower back can produce pain in the buttock, thigh, calf, and even the foot. The location of the pain often depends on which nerve root is affected. For example, compression of the L5 nerve root may produce symptoms that differ from compression of the S1 nerve root. Understanding this pattern helps healthcare professionals identify the source of the problem during assessment. Now that you understand what the sciatic nerve is, let's explore why it becomes irritated in the first place. The most common cause of sciatica is a herniated disc. Between each bone in your spine is a soft cushion called an intervertebral disc. These discs act as shock absorbers and help your spine move smoothly. Sometimes, because of aging, heavy lifting, or injury, the outer layer of a disc can weaken. When this happens, the soft inner material may bulge or push outward. If that bulging disc presses on a nearby nerve root, it can trigger the symptoms of sciatica. Another common cause is spinal stenosis. This condition occurs when the spaces inside the spinal canal become narrower, placing pressure on the nerves. It is more common in older adults. Sciatica can also occur because of spondylolisthesis, a condition where one vertebra slips forward over another, reducing the space available for the nerve roots. In some people, the sciatic nerve becomes irritated by the piriformis muscle, a small muscle located deep in the buttock. When this muscle becomes tight or inflamed, it may compress the sciatic nerve. This condition is called piriformis syndrome. Less common causes include spinal injuries, tumors, infections, or pregnancy-related changes. Although these are less frequent, they should still be considered, especially when symptoms are unusual or severe. No matter the cause, the result is often the same: pressure or irritation of the sciatic nerve, leading to pain that travels down the leg. Sciatica can feel different from person to person. The most common symptom is pain that starts in the lower back or buttock and travels down one leg. This pain may reach the thigh, calf, or even the foot. Some people describe the pain as sharp or stabbing. Others describe it as burning or like an electric shock. Along with pain, many people experience tingling, often called pins and needles. Numbness is another common symptom and may affect part of the leg or foot. If the affected nerve controls certain muscles, weakness can also occur. For example, a person may have difficulty lifting the front of the foot while walking, a condition known as foot drop. The pain usually affects only one side of the body. Many people notice that their symptoms become worse after sitting for a long time, bending forward, coughing, sneezing, or lifting heavy objects. These activities can increase pressure on the irritated nerve. On the other hand, gentle walking or changing positions may temporarily reduce discomfort for some people. It is important to remember that not every person with lower back pain has sciatica. The key feature of sciatica is radiating pain that follows the path of the sciatic nerve. So if these are the symptoms, how do doctors confirm that it's really sciatica and not another condition? If you found this video helpful, please give it a thumbs up, subscribe to MediLearn Hub, and share it with someone who might benefit. Don't forget to leave your questions or topic suggestions in the comments. Thanks for watching, and I'll see you in the next video.